Welcome, everybody. We are back for another episode here on Wellness Decoded, but we're going to change it up a little bit. Part of what we do at our practice is advanced aesthetics. So we do some things that probably plastic surgery used to have to take care of only like 10 years ago. And the advancement of technology, especially out of South Korea, because they're really known for a lot of their aesthetic services and their equipment. And so today we're going to be talking a little bit about chin fat, acne, under eyes, the bags under the eyes gone with a treatment that comes from the Agnes RF. And so why don't we kind of first start with a little explanation of what the Agnes RF, and then we'll go through some of the questions that we got here.
Okay, so the Agnes machine is kind of neat because it targets fat. So the cool thing about fat is we only make that during puberty and pregnancy. So if you're going to try to get rid of fat, by losing weight and then you gain weight, it's just going to come back because those fat cells got larger. But if we kill those fat cells and ablate them, you'll no longer have them. So submentum fat, under eye fat, sebaceous glands for acne, that can shrink those sebaceous glands as well and cause or help for that acne to never come back because it's impossible to infect something that's not open. So that's another idea. There's plenty of other things that the Agnes machine can do, but we're going to kind of focus on those three things.
So talk a little bit about actually how the machine works. What type of technology? I'm not sure if you
Radio
mentioned
frequency.
radio frequency, right?
And
Okay.
it's a needle, and the radio frequency, bipolar radio frequency machine will target that area. So
Right.
we will actually go into whatever area we want. I feel like that little wand that we use is like a paintbrush in a way, because you literally act like an artist when you go in and you ablate that fat.
Yeah, you can really sculpt
Yes.
and remove some of that. Okay. All right. So let's talk about the submental fat around the double, or what we know as the double chin. So talk a little bit about that.
Okay, so submentum is everything underneath here, this area, right? So a lot of us end up kind of getting fat here as we age, or in the jowl area here, or in the buccal area here as well. So a lot of people will want a little bit of restructuring of that area. So the way I do it is I just basically will ablate that area with this non-invasive machine. It's only invasive with the needle. It's not invasive per se where we have to actually go in and cut you open. So you can use plenty of like topical anesthetic, or we can inject lidocaine and prevent the pain. With that, we also have something called nitrous oxide that will help. But as the needle goes in, you can hear a nice little pop, pop, pop sizzle. And when you hear that, you know that you're actually popping those fat cells open and ablating them. People ask that question all the time of where does it go then? Well, it just really goes into the lymph system and kind of flushes from there.
Right. And you also have to be a little careful because some people just retain water versus that being fat. So you do kind of check to make sure it is fat, not water.
Right.
Because it doesn't help with if somebody's retaining lots of water.
Yeah, it doesn't, but you can kind of tell the difference.
Right.
And we will check to make sure that that's the case with you.
One of the cool ones that when we got this machine and we learned a little bit about it was the acne side. We have kids that have had acne, all of them. They've all been on different medications, whether it was a topical or an oral. And we know that those are somewhat toxic, I guess.
The oral for sure, like if you're doing Accutane, they're very, very strict on checking liver enzymes and things like that while you're on it, because you can actually develop um, a damaged liver or toxic liver.
I remember our daughter had to be on birth control at a very early age while she was on this medication.
Because the medication itself is teratogenic to a fetus, meaning it can cause abnormalities.
Right.
As
And
the
so
fetus grows.
basically you can and the cost with the Agnes and doing an acne treatment is very comparable to doing, the creams and the pills and all of that, but without the side effects. And so we've had several patients that, have gone all over the place, have tried everything. And when they finally came in here, it was like a godsend to them.
Yeah.
And so if you're concerned with those type of things for your kids or even for yourself, because this can be for kids or adults, and now's really the time, school coming back and all of that, we've been really kind of focusing on promoting this because kids as they get older, they start looking at their face and then they don't want to have that acne, and
Right.
adults as well. We're both
Right.
that, we're both that way. So
Yeah.
talk a little bit about how it really treats a little bit more in depth with acne and how it treats it.
Yeah. So on our faces, we have sebaceous glands. Those sebaceous glands produce oils. Those oils get infected with bacteria or dirt or whatever, and that causes the acne. Sometimes those sebaceous glands can be overactive for lack of moisture, so it produces more. And then that can cause acne. Well, it
Yeah.
could be overwashing of your face.
Yeah, true.
Overwashing and taking too much of your good oils away will cause that sebaceous gland to be overactive and produce more oils, which then in turn causes more acne. So people get frustrated because you think you're washing your face and it's not working and etc. But
Right.
basically the radio frequency from the needle, from the Agnes needle, will shrink the glands, reduce excess oil production, and help to prevent those breakouts. It's very, very effective for persistent acne and cystic acne. Those cysts that hurt really bad under the skin. It's amazing how it can ablate that and get rid of it almost in a few days. In those few days, that pain and that cyst goes away. And the treatment always helps with scarring as well. But what's cool about radio frequency is when you go in with the radio frequency, it actually causes an injury to the dermis, right? But then all of your growth factors go to that area to help repair it. So sometimes that's what you need is to have some little micro traumas to start or trigger that, for lack of a better way to say it, just like resurfacing of that
Right.
scar.
Kind of regenerating that area and helping that area heal. When the needle goes in, is it killing that gland, that sebaceous gland permanently
Yes, you will not have acne in that
in
area
that spot?
again. Yeah.
Now, we have thousands upon thousands of those glands, right, in our face. And those glands are there for a reason.
Yeah, because
So,
we definitely need oil to our
right,
skin to keep it
right.
nice and young looking.
Yeah.
Right.
But you have plenty. So killing few of the targeted ones in those areas are not going to cause any problems.
No, not at all. In fact, you do get acne in stages. So 30 days, the first time we do it, we'll do it again in 30 days. I do recommend that my patients take pictures of their face at throughout the month to see if there's any extra breakouts, and we'll treat that area when you come back in. And then we do it a third time. And you should have reached all of those stages of acne growth. Some people have to come in and get a treatment like every 6 months to every year after they've done their first three initial treatments. And it depends on how bad your acne is. And if you are extremely prone to acne, even if we've balanced hormones and we can't figure out why, this is your very best friend.
Right. Now, not everybody is going to be a 3 treatment done. We've had some people go up to probably 6
And
because of the
those,
severity, right?
yeah, severe
Severe,
acne,
really
yeah.
bad.
Or, yeah, there's hidradenitis suppurativa as well as another condition that people will get these really hard cystic acnes in their groin or under their armpits. This is a treatment for that too.
That's great.
Yeah.
Yeah, absolutely. So that's definitely a good one. And then we also, not to veer off too much, but we also can follow up with PRP treatments, microneedling, things like that for resurfacing.
Yeah.
And to really kind of round out the whole healing process.
Yeah. We do like to actually do for people with scars, do an acne, a PRP microneedling treatment in order to get those platelets into the skin and help it to heal those scars even more. So
Right.
that's
Absolutely.
a really nice
Yep,
way to
absolutely.
do it. Yeah.
Okay. All right. The next one we're going to talk a little bit about, and this is a very popular one as well, is that those under eye bags.
Yeah.
And that puffiness.
Yep. So the problem with the under eye bags is sometimes it's water, sometimes it's not. So if you wake up in the morning and your eyes are puffy and that stays puffy all day long, it's usually fat. If it goes away, or at least by 50% goes away by the end of the night, it's water. There's another way that we can check by pinching the under eye bag, the bleph, and see if you actually have fat deposits underneath the eye. And if
Hmm.
you do, we can treat that. No problem. It's amazing. We ablate all that fat and we do side by side pictures during the procedure, and you can see the difference already.
Right.
Yeah.
Okay. So everybody is afraid of needles one way or the other. Some people, they don't really care. I know when I did the Agnes on these type of bumps on the back of my neck, it was, I could feel it, but I did obviously take the Pronox, and it was like I wasn't feeling anything.
Yeah.
So talk a little bit about, is Agnes painful, and how we handle that.
I mean, it has minimal discomfort, I'm not going to lie, but you really do need to understand that these are very fine microneedles that go into your skin, and we are using precision as we do it. And we do start with a topical numbing cream. But if that's not sufficient, we will inject lidocaine and you won't feel a darn thing
Right.
at
And then
all.
we top it off with Pronox, and it's not like, yeah, you don't feel anything.
Yeah.
So
Yeah, you don't usually feel anything if you're going to do the Pronox. And the Pronox is really not to take away complete pain, but it's to help you relax.
exactly.
Yeah.
So everybody always asks, not only when we get messaging in and emails, they obviously are asking pricey and things like that, but they always talk about how many sessions. So talk a little bit about that, and a lot of times why we don't quote how many sessions until we actually get to see the patient.
Right. So the number of sessions are varies depending on the area being treated and the individual skin condition. For submentum fat, most people see results after just one treatment, but that's not going to be enough. That's not going to be sufficient to do one treatment, because you are going to notice that after 30 days that a little bit more of that fat has settled, and we know what needs to be taken out, and we do the second treatment. The third treatment is for the artistry, right?
Mm-hmm.
So we want to make sure we define that jawline. We want to make sure everything looks perfect.
Mm-hmm.
And so 3 treatments is always recommended.
Yep. A
Always.
minimum.
Minimum.
Yep.
Plus,
Right.
when you do 3 treatments, you get a discount versus one treatment, you pay full
Full price.
price.
Right.
Yeah.
Exactly.
So that's with the cementum. But with the acne treatments, it typically requires multiple sessions, at least 3, but then we can do more if necessary or if we feel like there's something. But you want to make sure that those acne treatments are at least 3 weeks apart, but preferably 30 days. Some people who are in town visiting or whatever will want it done a little bit early. I don't mind as long as it's been 3 weeks for the best long term results. Under eye treatments usually require 1 to 2 sessions for noticeable improvement. And the third is exactly like what I said, to do that artistry, making sure that we don't have anything else that needs to be taken care of. But also, if you remember, radio frequency from the Agnes tightens the skin and increases the collagen production as well. So we haven't brought that up yet, but every time we use it, you're increasing that collagen production and tightening the skin. So I would probably, if all this under eye bleph fat is gone, I would probably utilize that third treatment to tighten up the skin really well.
Right. Now, one of the things that I think we failed to mention about the Agnes and what you've done for people is the fat relocation procedures, where people take fat out of their butt, they put it in their face, and you've seen some of those like
Oh, yeah.
gone awry. They come in and
Yeah.
they're kind of all misshapen in the face,
Yeah.
and you actually have to go in and kill
Mhm.
that area as
Mhm.
well. So that's another thing we can do. Right.
So, and I have had people come in with lumps on their face from the injections of fat. And so I came in and they came in and I just nicely smoothed that out. I have a person who came in and had removal of fat from their legs, and there was a lot of lumps that they had left when they pulled that fat to place it in their butt. And oh my heavens, there was so many lumps. I was able to remove almost all of them, I think, in 3 treatments. And that
Yeah.
was a really nice treat for that
Right.
patient. Yeah.
Absolutely. Okay. Is there any side effects with
Um,
Agnes?
Agnes is generally considered safe with minimal side effects. The most common side effects include the redness, swelling, or slight bruising. Now, remember, the face is very vascular. So when you do the under eye, you're going to have a lot of bruising, especially if your skin is extremely thin. So don't expect that bruising to go away for 30 days. And that, I'm just going to throw it out there. You will have to make sure you have some nice cover up for that. But it's well worth it, because if I missed those little veins, and went around them each time, we would be missing fat. So it's really important to get at the whole area. And so if we want to miss them, I can try it the first time. And then if we see any like little lumps, we will have to go over those the second
Right.
time.
And remember, by doing this, you are saving yourself from going under the
The
knife.
knife, yeah. You
And we
don't
have a
have to.
lot of patients that just do not want to go to a plastic surgeon for that type of stuff.
Exactly, yeah.
And they obviously they can do it, and a lot of them do it really well, but you are going to have some scarring and you'll see some other things, but you're going to have the black eyes and
Yeah.
all of that. Just remember that by doing this, you still are not going to have any cuts in your
Yeah.
face,
And
which is nice.
I was just talking about the left side of the eyes.
Yeah.
The cementum and the jowls here, as well as the acne, you're only red for a short time, like 3 days. And
Okay.
then some bruising under here, but usually no bruising for the acne treatment. And everything is different,
Yeah.
but the under eyes is very vascular.
Perfect.
If we see any type of changes in skin pigmentation or anything like that, that usually is a result of when you are done with your procedure, going out into the sun. So we will treat that with like PRP, but you have to stay out of the sun afterwards,
Right.
or you will develop some hypopigmentation.
Yep. Okay. Next one we talk about is we get a lot of questions. How long is it going to last?
The results of Agnes are very long lasting, especially for the submental fat in the under eye bags, as these fat cells are completely destroyed. You will never get those fat cells back. So that's why we're very careful. And that is really one of the reasons why we do 3 treatments. So we don't take away the good fats that we want to leave in the body. So if you're someone who's coming in for this nice, suck in the face, buccal fat removal, we're very careful. We map it out. We make sure this is where we're taking from. We're not taking any of your beautiful cheek fat. We're not taking any of the other fat that you really want to have in your face. We're very careful. We have to make sure that it is exactly what you want. So we do stage by stage by stage.
Right.
One first treatment is a little bit, the second treatment is a little bit more if you want, and then the third is just tightening.
Okay.
Yeah.
So next is who's a good candidate?
There's a lot of people who are on blood thinners and things like that. If you want to do this, you cannot either be on the blood thinner or you have to expect bruising. Okay. If you want to do it and you are on blood thinners, we would definitely have to make sure you know that there's going to be some bruising. It is an ideal treatment for people who are looking to reduce submentum fat, stubborn acne, diminish under eye bags, puffiness, who want to kind of like shape their face a little bit nicer and have a nicer profile. But it's important to consult if you have any type of issues like cancer or any type of blood clotting issues. I want to know that beforehand, and we will make sure that you're a good candidate before we do that. And then we'll also make sure that you're not on medications that can.
What about any metal in the face?
That's
in the mouth or anything like that?
The Agnes is not something that we would have any trouble with
Okay.
the metal.
All right, perfect. And so the other question that we get a lot is like, okay, when can I, resume normal activity? What does that really look like? Because there's normal activity to one person's different than another's. What are all the things that go?
Well, most people can return to their normal activities almost immediately after procedure, but some mild swelling and redness can occur. Those resolve within a few hours and days. But if you're a really hard worker outer, then
to the gym,
you might want to wait 24 hours because your body is causing all of your growth factors to go to that area that we're treating and healing it.
Yeah.
So, if you start working out, then all those growth factors are going to go to the areas that you're working out instead of where it needs to go. So 24 hours before you do any crazy workouts.
Okay. What about going out in the sun?
Going out in the sun, you want 24 hours for sure. And anything after that is 30, 40, 50 plus sunscreen in order to prevent any type of the hypo or hyperpigmentation. I don't want to see you out in the sun tanning until after the 72 hours. And I don't ever want to see you out in the sun tanning your face anyway.
Now, you talked about sun block lotion. Here we have mineral based, right?
Mineral based always. You never want to use anything that is chemical based. The mineral will go into that micro trauma and not affect it.
Right. Okay. All right. Anything else that we may have forgotten or that you have thought about to let people know about the Agnes?
What's kind of neat, and one thing that we did not mention, we can tack and pull your face up a little with the Agnes machine. It's absolutely amazing. So tacking is another procedure that we could do, and it's just basically tacking to that fat. And so it's going and pulling that skin up. And we actually see some really cool post treatments. Like if you do one side first, we have some really cool comparisons and how high it did tack. Like each time you do it, it goes up at least 1 to 2 millimeter,
Right.
which is pretty impressive.
That's great.
Yeah.
So, okay, perfect. Well, obviously a little bit different than what we've talked about here on Wellness Decoded. This is more of the advanced aesthetic side. But here at Optimum Health, Integrative Medicine, we really kind of focus on people feeling better, looking better, and living a better life.
Right.
So we're kind of this holistic 360. So we do several things within our practice, and some of the new regenerative stuff that we're going to be talking about soon on the O side, we're super excited about. But yeah, we were happy to kind of talk a little bit about this one, just because we've got school coming back. You've got kids that are now kind of growing and getting in, through puberty and all those different things and getting the acne, and they're very self-conscious.
Yeah.
And who really wants to be on those toxic pills and creams and stuff like that when you can actually do a treatment and get rid of it?
And we do have some really cool back to school specials for acne treatments on your teenagers or yourself, because it's really actually those teenagers going through those horrible, tough teenage years in their life where they could do without acne actually. And I think this would be so much better than putting them on Accutane.
Yeah. We've got a couple different ones where you've probably got up to $400 to $500 in savings, and we'll put those in the body of the post and of the video, so you can kind of check those out with a link to take you right into our website and book an appointment for a consultation to come in and talk with Darlene and our other providers, just to kind of see if this really it would work for you. So, all right, well, that's everything on this one. We definitely love having you along, and we're going to be talking about all kinds of great things and having guests on our show. So please give us a thumbs up. Also, share this with as many people that you may know that needs this, and please consider subscribing to our channel and putting that notification on, so that whenever we do post a video, you get that notification. You can jump right in and take a look at the new content that we have. So that's it for today, and we will definitely see you on the next one. Love you.
Love ya. Bye.